Vodafone cares about you and your health. HealthFest has gone from strength to strength. It gives hope to many Ghanaians across the nation with its free medical assessment and care. The Medical Call Center 255 continues to empower Ghanaians with our unique phone-in medical consultancy. But it all started here on your TV screen with the award-winning program Healthline. This week on Vodafone Healthline.
You know, having a child at home can be so much fun, but there are so many things you need to do to make sure that they stay healthy and grow up to be healthy individuals.
In the field, we meet Robert, whose future is in danger.
The biggest part of living healthy comes down to simply making healthy choices. On Healthline, we discuss and help you make these choices. Sit tight and enjoy the show. My name is Lorraine.
I'm Papani.
I'm Ruth.
And I'm Bright.
And we're your doctors. Susie is calling from Ofanko. Go ahead with your question, please.
Hello, doctors. My sister has sickle, and I see how her conditions make her suffer so much. I am AS, and there isn't a guy who is also AS, and we want to get married. Is it a good idea? Please advise.
Okay, so Susie, I'm sure you mean that your sister has sickle cell disease. Now, we all have blood, and in the blood we have something we call hemoglobin, and that is what helps it carry oxygen and gives us energy, etc. Now, our parents contribute to the characteristic of our hemoglobin. So we have different types of hemoglobin. We have A, which is normal. We have C, which is abnormal. Then we have S, which is abnormal. Now, everybody has two of these. So you're either AA, AS, AC, SC, CC. So they are basically different combinations and permutations. But the most important thing is that you get one from your mother and then one from your father through some sort of combination. Now, when you have someone with AS, and that person combines with another person with AS, when these two people come together, they have a 25% chance of having a child with sickle cell.
But at the same time, there's a 75% chance that you won't have a child who has sickle cell.
The cup half full.
Exactly.
Yeah.
So it depends on how the two of you feel about each other and how much risk you're willing to take as a couple.
I have very good friends that are like brothers and sisters that have sickle cell, and they have amazing lifespans. They do well. They even do better than us in class most of the time. It's about giving them a chance, giving them adequate care, making sure that you take very good care of them, prevent them from getting infections. But then having a child with sickle cell is not a curse. You don't have to be a doctor to help. Here's how.
No, I'm not a doctor, but with first aid, I can help. First aid for asthma. Don't leave the person alone. Help the patient into a comfortable sitting position. Be calm and reassuring. Give 4 puffs of a prescribed reliever. Shake the reliever before each puff. Give 1 puff at a time with 4 breaths after each puff. Wait 4 minutes. If there's no improvement, give 4 more puffs. If the person still cannot breathe normally, call for an ambulance and report an asthmatic attack. Keep giving 4 puffs every 4 minutes until the ambulance arrives.
I'm okay.
So you see, it's not really rocket science now, is it?
Vodafone, power to you.
You know, having a child at home can be so much fun, but there are so many things you need to do to make sure that they stay healthy and grow up to be healthy individuals. Before you touch your baby, make sure you wash your hands or you use a sanitizer. Also, when you're going to feed your baby, make sure that all the bottles are clean and sterilized. Use warm water to wash all your instruments and make sure your baby is fed under very clean conditions. When you're going to bath the baby, make sure that you use a good bath that's big enough to be able to accommodate the child and help the baby to be able to move around comfortably. Preferably, it should have its own drain so that when you wash the baby, the water flows away. If you're going to play with your baby, don't play too many rough games. You know, it's nice, they like playing rough games a lot, but be gentle. Babies are not made and are not ready to be shaken vigorously or pushed around just like that. They're still very fragile. Do all of these things and you know that your children will actually grow up to be young, strong, and healthy. So, till next time on Street Doctor, take good care of yourselves and take care of your babies, all right? Bye-bye.
Let's help you maintain a safe and healthy environment for your child on Kids Corner. Today, we talk about breastfeeding.
It's quite interesting, right? Because most of the time we talk about breastfeeding and encouraging breastfeeding at least exclusively for the first 6 months of the life of a child. And then we talk about the protective and nutritional benefits of breastfeeding. But Ruth, can you tell me what else can we talk about with regards to that?
I think what most people don't mention is the fact that you do it for 6 months and continue for up to 2 years. That's what WHO says. I wonder how many women can do that. Anyway, you know, what's important though is the initial stages of helping a child latch onto the breast. That's very difficult for a lot of mothers. The baby's mouth should engulf the whole areola, not just the nipple.
The areola is just the skin around the darkened area.
The nipple is the protrusion. Beyond the protrusion, you have this broad area that has these little tiny dots on it. That's the areola. And that's where all the milk gets stored in. So if the child is just sucking on the nipple, the milk is not going to come out. They need to kind of push beyond the areola and it presses and pushes it to come. So that latch is very important. If you don't get it well, the child will be chomping and getting nothing.
Breast milk is produced by what we call a milk let down reflex. So the mere fact that there's a sucking process, it stimulates hormones in the brain that would signal down to the breast, cause the milk to flow. So the latch, like Ruth said, and the connection and the appropriate sucking action is important.
It's very important that breastfeeding starts within the first hour of the baby's life. This is because the breast milk itself contains something which is very important. It's called colostrum. Colostrum contains something that acts as a laxative, and this helps to purge the baby's intestines. And apart from that, it also helps to protect the baby's intestines from harmful things that the mother could otherwise take. As the baby continues to suck, the colostrum actually changes into something we call fore milk. Now, fore milk contains a lot of proteins and a lot of vitamins, and proteins help the child to build its body up, and the vitamins help to prevent infections. Later in the breast milk development, we have something we call hind milk. And hind milk actually contains a lot of fats, which provides a lot of energy for the baby. Breastfeeding decreases the risk of respiratory diseases, decreases the risk of asthma, diarrhea. Babies that are not breastfed are also at risk of developing diabetes and also obesity in adult life. For the mother, it actually serves as a mechanism for weight loss. But on the more serious side, it actually helps the mother to stop bleeding soon after delivery and also helps the uterus to contract quickly after delivery. So it's very beneficial for both baby and mother.
Time to get rid of those myths. We take a question from the audience.
Hello, doctors. I've heard that cleaning your face with your own urine can get rid of facial blemishes. Please, how true is this?
Priscilla, I think I'm actually glad that you actually stated that it's your own urine. I mean, I don't think anybody wants to be using somebody else's.
Hey, can I borrow some urine?
Can I borrow some urine? For starters, urine is a waste product. If it was meant to be in your body, it would have been there in the first place. You wouldn't have taken it out. Urine mostly contains water and something called urea. Now, we found out that urea in itself has a tendency to exfoliate. What it means is that it helps clear the dead cells from your skin. Urea also has this tendency to absorb moisture. By that translation, you're trying to say that putting urine on your face helps keep your face moist, fresh, and clean.
And we should keep in mind, you know about an infection called UTI. It's a urinary tract infection. Urine, although sterile, can get infected. So assuming that you want to do this kind of ablution every morning and you have a UTI, you probably have some zits on your face that are open. You'll be seeding these zits with the infection in the urine. So in all that is fair and nice and good and sanitary, I would advise get some facial cleansers. They are available in the shops and they're not so expensive.
Please leave your urine alone.
The following segment contains material of an adult nature. Viewer discretion is advised.
On this segment, you get tips on sex and romance. Sit and join the discussion on Sex Talk.
We have an SMS from Nana. Nana doesn't say where she is, but she asks, I have heard people say that women can have multiple orgasms. How come I haven't? Well, Nana, this is actually quite an interesting question because a lot of women don't actually even get the opportunity to experience one orgasm in their lifetime. What more multiple orgasms? You must take sex as something very enjoyable and see it as a game with your partner. Because if you're always just too focused on your partner and you're not sometimes focused on yourself and trying to enjoy this amongst yourselves, it makes orgasm something very difficult to achieve.
Another reason why some women have difficulty having an orgasm at all is that the whole sexual experience is a chore for them because they have a vaginal infection, or what we call vaginitis. So if you have a vaginal discharge there's burning around over there, or the discharge has some offensive smell, that's not very normal. Or you have an itch around the place, that's also not very normal. Some women also have what we call vaginismus. So the whole muscle around the vagina cringes at the thought of an entry. And then when there's penetration, they still have a lot of pain and they can't get over that. So people like that will need counseling.
Don't worry about whether you only have it once or more. The thing is to enjoy the moment and not the number of times you have it.
I'm Godfred Kluger. Last month, I was having some problem with my heart. It's not in my heart, but I have some vibration within my heart. So I called Vodafone Healthline to talk to a doctor. He asked me if I have any anxiety, if I'm worried about something, if I'm thinking about something, and I said no. Then he asked me if I take too much salt, and I said yes, salt, I like salt. So she was advising me on how I should minimize my salt intake. So maybe from the time that maybe she's talking to me, I should take less salt and let's see how it goes. And I've seen that from the time that I've reduced my salt intake, it has been good. I've never experienced such a thing again. So I encourage people to give a try, because sometimes self-medication is not good. When you call, you talk to a medical doctor, and then they'll have time and explain things to you. So I thank Vodafone Healthline so much for giving such opportunities for Ghanaians to experience. Thank you.
Robert says Ben Carson is his role model. He is intelligent and his dreams are crystal clear. However, his entire education and a fair chance at achieving his dreams are under threat and will all go down the drain should he not find medical help as soon as possible.
Almost 1 year, it's a crashing in brain. The same neurosurgeon. Without this surgery, I don't think I'll be the Robert I know.
Robert is an 18-year-old sickle cell disease patient who has been attending our clinic for some time now, and he's been on pain medication for the past 6 months. It's worsened, his hip joint is now short, contracted, and has required the use of auxiliary crutches to move. It's really pity to see this young man, when I knew him some time ago, about 4 years ago, used to walk normally. But right now the limb is shortened and deformed and he really needs surgery to correct the deformity.
Mentanya, but Toma Yari started. Now, I started na me nine to me kakra. But now me who say that serious. Now, to me and my catcher, mamma say, man, patch of family hospital. Na me nine me ya. No, cause the old junior and she, oh dear, to book a cracker, a belco. Around May to June, I feel now, and we me ya. We am catcher, mamma say, on family hospital. To other me corner, ya Jimmy to Anna. Doctor Nessie may drop your leg into a bit my something serious into no almost Jim into on. Jomo Jimmy to on. We were son, I had the clutches. A bear me say, me using a mammy for seminine. As I may for seminine, a bit short now have effect on it to have effect on me.
Internal rotates. Oh, it's hurting you, right? Sorry about that. But Dorshin. All right.
First crime agent say because no, you're very active, but you're in PN one and now I call so say in final hospital. Now I must say doctor say a bad operation. And Ukraine name Mitisano me who Germany, me who their mayor because through but for my near dear. To my afford. Hey, it's kind of there. Many baby am Mineska. Midim Pieball, Namidita me Banich. Pieball, Quanamita. Because a bino, Miss Minimubi, a Juma me and a near Juma be as a it my receipt, Fanamico J. Luna. Or Bobia. Idea, I am by Bonkwana. Medita me bandage.
We only did my pass. Ja, you beer. You beer or how about me.
Education, I do it. I buy it. School crowd, family say school, me go school. I can first me pa me go school me family say JHS. I was one of the good students. I was one of the best students in my class. This year school make me dress as I do start here. School I find school. Me twice a week.
Anita attends the same school as Robert and helps out by bringing work home for him and telling him what's been going on at school.
Pacho, when you my dear pa and dear can you my dear pa uncle schools, a ya or if you uncle schools or a shack or ya dear pa, a book crying a madam crampo, a catcher me say, I will be or if you now or pass the whole class son. Even crampo last term crampo on class no defense. Or ya dear pa only dear, a yam bar one for book no see, but uncle schools so on no the best students.
Me bano no assembly dear. I have me too much. I'm because me banana me akuma. And so they are banned there.
If Robert doesn't get the surgery, he will end up with so many complications. Most of them start with ulcers because they are always on pain medication and they tend to develop gastric ulcers. Sometimes they bleed to death.
Mamma dear, and when you know there. Oh, in a balcony. Sometimes I'm to make cars just for me to take off my mind from way, you know. Sana, I don't know, and my name is for there. It's really tight.
And the same as Shana, personal woman, dear, now, I say, they be no or soon. Osugu ni yemo sa anti nkran sha the same ponu po na shaman crying.
The following scenes contain images that could disturb sensitive viewers. Viewer discretion is advised. Vodafone would like to thank the 3MNC Medical Center in East Legon.
What we're going to do is called a cementless total hip replacement. So we're going to replace both the cap and the stem. So we're going to approach the hip from the lateral side. The recovery rate is very good. Patients get back to their normal activities after an average of 6 weeks. We implant this shell into the acetabulum, so this serves as a new cap, right? If you see the X-ray, you realize that the whole cap and head is destroyed. So when you introduce this into the stem, then this trial head, you mount it on the head, then you reduce the hip so you get a new hip joint, right? So as you can see, it moves and is quite stable, and the patient can return to their normal activities without having to take pain medication or use crutches.
Robert is here with his mother, Veronica, and Robert Sr. Please put your hands together as they join us in the studio. You're welcome, you're welcome, you're welcome. Robert, I'm so happy to see you. You look very good. How are you feeling?
I'm okay.
What are you able to do now?
Everything a normal person can do.
Really? So what couldn't you do before?
I couldn't bend. I couldn't stand straight.
Okay.
I couldn't squat. Now I can do like anything a normal person can do.
Wonderful. Robert, so can you get up? Let's see. Wonderful. Nice! Wonderful. And as you stand now, do you have any pain?
No.
At all?
No pain.
That's great. That's great, Robert. Have a seat, please.
Thank you.
So, Auntie Vero, nti won so afei wo hu se wo ba no sesi a wate apoi wo bibi eka efa ne sesi a sesi ne otie ne ho ana.
Me ame ni se nyankopon na ma akwan ma boda fo ba ya akwan mu. A mutim bebua ne be.
So Robert Senior, this is from Vodafone to help Robert in his recovery. Okay, there you go.
I thank Vodafone so much for what they have done for me and my family. May God bless the company.
Amen. On this happy note, I say thank you all for your participation. It's been great sharing these life-changing moments with you. Join us next week for another exciting episode of Healthline. Goodbye, and let's give thumbs up to good hygiene.
Vodafone will continue to support this program. If you have been moved by the stories or issues you've seen on Healthline, you can donate by sending your contribution via Vodafone Cash to 835-000. Next week on Vodafone Healthline, our doctors talk about the skin. In the field, we catch up with Mami a year on from her treatment.
Vodafone, power to you.